The main function of the lens is to transmit light to focus on the retina. Here in the retina, the image of our reality is formed. Cataracts are triggered with age, where proteins and fibers in the lens of your eyes start to break down and clump together. Clouding of the lens of the eye is what occurs, and seeing halos around lights and difficulty with night vision are common symptoms. The tools used in this experiment are the LRI diamond knife, the irrigation and aspiration handpiece, also called an IA handpiece, and an intraocular lens injector. During the procedure, the patient is usually conscious, and they're provided with topical lidocaine as well as oral Valium. First, the ophthalmologist will conduct a 2.4 millimeter incision using the LRI diamond knife. Next, either using a probe or the IA handpiece, the ophthalmologist will insert the tool at the site of the incision and conduct breaking down of the lens, also called phacoemulsification. The physician will break it down into several pieces. This will aid in the vacuuming process that is also conducted by the IA handpiece. The vacuuming is done in a meticulous manner throughout the entire capsular bag of the lens. And as you can see here, the lens has now been removed, and then using the intraocular lens injector, the physician will insert it into the site of the incision and release the artificial lens. The artificial lens is then moved around in a 360-degree manner to make sure that no previous lens material is still present. That is the end of the experiment. Thank you.